Hi, I'm Brandon Pounds. We're working on SOT videos and we're doing patient assessment. So this first one we're going to do is we're assessing category 1, 2, and 3. At this point, I'm using my thumb as an indicator and looking to my right eye at the AC joint there, acromion process. I'm having the patient stand there and I'm assessing for P to A to P sway. If the patient sways forward and backwards more than 1/4 inch, that's going to be indicative to a category 1. Next thing to do is have the patient turn and face away from me. Still using my thumb, I'm going to assess if the S2 tubercle of the patient. Okay? And now I'm watching for the patient to sway from side to side. If there's movement more than 1/4 inch either way, it's going to be indicative to a category 2. If the patient presents with an antalgic lead to one side, that'll be indicative to a category 3. Okay? Now, the next step we're going to do is our first rib palpation. Patient will sit here. So I'm palpating for the first rib. Boom. Okay. Now I'm going to have the patient flex his head forward. Now extend all the way back. Flex his head forward again. Excellent. Now what I'm looking for is the rib head movement. If the one rib moves up, that's going to be, and one moves up and one doesn't, it's going to be indicative to a category 2. If both ribs move up, excessive movement, it's going to be indicative to a category 1. If we have no movement at all, it's going to be indicative to a category 3. Okay. The next thing we're going to do is our cervical stair step and cervical indicators. So the patient's going to lay down flat on his back there. Hold the patient's head so we can slam it. Okay. So what I'm doing now is I'm palpating C3 and C4 on the I'm palpating C3 for bilateral lamina tenderness, and if there is tenderness, it's going to be indicative to a category 1. Around C4 on the left lamina, if there's tenderness, that's going to be indicative to a category 2. Now the cervical region and the lumbar region have a little bit better connection. The C3 is connected to the L3, the lumbar, and the C4 is connected to L2 in the lumbar region. If there's tenderness on the spinous process in the cervical region, it's going to be tenderness on the lamina side, on the mammillary in that lumbar. And if there's tenderness on the TVP on the left, it's going to be tenderness on the spinous process in the lumbar region. Okay, so the next step is going to be our cervical compaction and stair stepping. So the first thing I'm going to do is supporting the head here. Okay. You're going to push SI on the head, compacting. Oh, excuse me. I'm going to have the patient raise his legs up 18 to 24 inches. Thank you, sir. Okay. I'm going to push SI on the head, watching his feet move, and repeat the process again. Okay. If it was easier for him to do that, then it's going to be a cervical region. If it was harder, then we're going to look at the lumbars. That looked like it was easier. So now at that point in time, we're going to do the stair stepping. So there's 4 stages. There's T1 to C7. There's C6 to C5, C4 to C3, and C2 to C1. And what we're going to do is we're going to compact and stair step each segment. Okay. In the first stage of C7 to T1, if it doesn't click, there's no locking at that point in time, we're going to look to T1 to T4 for an anterior thoracic. If in the cervical regions, stages 2, 3, and 4, then we're going to perform the figure 8 at that area and then reassess. Our fifth procedure is going to be basic 1 and basic 3. So with basic 1, what I'm going to do is I'm going to put my fingers along the inferior nuclear line, starting from the EOP and moving medial to lateral. What I'm doing is I'm feeling for symmetric pulsation in my fingers as the patient just relaxes and breathes. Okay. Once I found that, then that concludes our basic 1. The basic 3 is going to feel for tenderness along the sagittal suture of the head. So I'm going to palpate till I feel pain. A little tender right there, sir? Yeah. Yes, there's pain there. So what we're going to do is we're going to split it here. Split in the suture. Okay. Right here. Okay. The patient's going to breathe in. Patient breathes in, bring them together. As the patient breathes out, I'm going to separate suture. Repeat that 2 more times. Breathe in. Breathe out. 1 more time. Breathe in. Breathe out. Very nice. That's basic 3. Now the 6th step is going to be our SOAS test. What we're going to do here, everything's removed. There's no watches or anything like that on the patient. No cell phones or anything like that. Take the patient's hands. We'll grab just distal to the radius here, distal to the wrist. Extend back, both feet together. Extend back. Bring the patient's hands together. Fingers extended, without looking. Fall together. Patient looks like he has a right short side. So what we're going to do is we're going to fix that. Patient's going to bend his knee, just like this. So I'm going to reach under your leg, stabilize your hip, and work on your sides. Is that okay? Sir? Here, stabilize on the trochanter, it's the belly button, the SIS, whatever we need to be. You got the patient breathe in, and as he breathes out, I'm going to dig into that psoas right there. Patient's going to repeat that again. Breathe in, and breathe out.
Get off there.
Very good. Awesome. Thank you, sir. Not the most comfortable thing, but we get results. So now we'll reassess. Feet together. Extend your hands. Extend your fingers, sir. Perfect. Bring them together. Patient's fixed. 7th test is going to be our anterior iliofemoral test. I'm going to have the patient swing around here if you would, sir. Okay, so with this test right here, you can swing right here, because I want you to swing right here so we can get the, okay, so what we're looking for, I have it here, rotating the legs in, okay? What I'm looking for is symmetry between both feet coming in together, or about 45 degrees. This left side right here doesn't seem like it's bending, it's rotating in as much. So this is the side that we want to work on, okay? So instructions for the patient. I'm going to loop around here over the greater trochanter. We'll lock in that ligament here. Patient's going to roll his rotated in, lock in nice and tight, slowly externally rotate. Awesome. 1 more time. Patient does it again. Perfect. Now this 3rd time, we'll count 1, 2, 3, and you're going to quickly rotate as I pulse in. 1, 2, 3. Perfect. Now we reassess. Excellent. Patient's fixed. Now, the last one's going to be our arm fossa test. So what we're going to do is we're going to find a strong muscle here first. Patient's up. You're going to extend your shoulder up. Okay. Right here. Perfect. Very good. Awesome. So you're going to press into my hand here. So we have a strong muscle. Now, sir, I'm going to have you kind of shift your anatomy real quick, and then find your pubic bone, put your heel of your hand on your belly button, and reach down, okay? We good?
Ready, doctor?
Awesome, sir. Thank you, sir. So here's the ASIS, and there's the pubic bone. So we're going to follow that anterior iliofemoral ligament. So we're going to start in the upper fossa, going for there. Strong. Strong. Awesome. Now we're going to repeat that same process on the other side. If we have a negative arm fossa test, that's going to be indicative to a category 1, and a positive arm fossa test is going to be indicative to a category 2. This concludes our video. Thank you.